All right, we live. We live. I am Dr. Jerisa ER, your good ER doctor, trying to help y'all be good patients. This is Code Blue live inside the ER. Today, today's live, we're going to be talking about alcohol. Three things: alcohol intoxication. When you should be concerned. Should you go to the ER? Should you not go to the ER? The second thing: marijuana. It's kind of tricky because everywhere, a lot of states are legalizing it, and there's medical marijuana, and then there's gummies, and some people don't know the effects, and you thinking you're okay, but then you're not okay, and you start to feel. Yeah, we're going to talk about marijuana, and then the third thing we're going to talk about is opioids. Opioids are just kind of near and dear to me because as we move into 2025, listen, there's not going to be much reason for us to not have the knowledge of something like Narcan. Okay, so that's the third thing. Third thing I'm going to be talking about is opioids. So we're going to start off with alcohol. This week we are giving away 3 cash apps. So if you have not subscribed, you want to go ahead and subscribe. You have to do 2 things. You got to subscribe here, and then you also have to go to the website, drjerisa.com, and you got to scroll on down and you got to subscribe to the newsletter there also. Okay. Once you do that, then you are in for the cash app. We're giving away 3 cash apps, $200 each this week. All right. So now that's the logistics. Also, we're going to be going live. I'm going to be going live on Thursday. So we're going to be doing like Trauma Thursday. So we'll be going live on Instagram. So that'll be cool. If if you're there, you see the live pop up on Instagram, you got any questions, you're in the ER, whatever, just chime in. Trauma Thursdays. Okay. Um, so now alcohol, intoxication. It's holiday time, partying. Well, actually, it don't have to be a holiday. It don't have to be a holiday time for people to be partying like that. But around the holidays, people have a little more excess to drink. And so trying to decide if you want to go to the hospital or not. Are you that bad off where you need to be seen in the emergency room? Um, so now, because there is a shortage of IV fluid, most emergency rooms are very cautious when and how much IV fluid they may give. If someone is drunk, severely overly intoxicated, vomiting, weak, lightheaded, almost passing out, vital signs, how fast is your heart rate, is your blood pressure low? Those are some of the things that we look at to determine, does this patient need IV fluids now, or can they get something like a Zofran IV or a Zofran dissolvable? I said Zofran, but it's other antiemetics, medications for vomiting. But because it dissolves underneath your tongue, that's kind of one of our go-tos because it dissolves. I mean, who wants to really take a pill when you're vomiting, right? But there's a dissolvable form of Zofran that dissolves right in your mouth. And so sometimes that may help and kind of speed things along if the person isn't as severe. Now, if they are really severe, vomiting, weak, lightheaded, dizzy, feel like they're about to pass out, then that may be someone where, you know what, you may get IV, you may get IV fluid. And so we really look at the whole picture to determine if this is someone that is going to get IV or not, right? The biggest thing I want to share as it relates to alcohol, because a lot of people feel as though alcohol, not even feel as though, it's really true, alcohol can affect the liver. Long term alcohol, binge drinking, even 1 glass a day, believe it or not, you could get, some patients, everybody's different. Some patients may develop something like cirrhosis later on. It can happen. I have seen it happen. Young lady, I'll never forget, she was like, had cirrhosis. And she was like, well, I really only have, 1 drink a day. But then you also may have the other person who may have two drinks every day, you know, two drinks every other day, three drinks every other day. What I'm trying to really say is that everybody is different, but it could be something as little as one drink every day for you. That could be a risk. So as we think about that, because we know alcohol can affect the liver. That's like, you know, we all know that. The biggest thing I want to shed light on also is that when there is a bit of denial about how much you're drinking, how often you're drinking, if you're really, you know, if you really have a perhaps drinking problem, as they say, okay, when there is denial, you don't get the help that you need. And you also don't get the treatment that you may need that can help your body cope with all the alcohol that you're drinking. Okay. Nutrients are so important. Nutrients are so important. Nutrients like what, Dr. Jerry? So you are which ones? Folate. Folate is very important. Thiamine is very important. The worst thing you can do is drink and drink and drink and drink and not really give your body these nutrients that is needed. Okay. That helps to protect here. So we see it often sometimes where patients are like, well, they just drink and they might go eat some food and then they just keep drinking, but they're vitamin B deficient or they are thiamine deficient, folate deficient. When you have those deficiencies, unfortunately, and I don't know if this is what happened with Wendy Williams or not, but many of us in the medical community think that perhaps maybe she developed something like an encephalopathy or a Wernicke encephalopathy, where the person may get confused because they're drinking, 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 and they're not balancing it out with the necessary nutrients that are needed. So that's why you do have some patients that come in. You have some drunks that will come into the emergency room often. We give them the nutrients. The emergency room can do that. So many, it kind of, I think we might have cut back to some degree because now, we can give the pills. When we used to do IV, we used to do things like banana bags and things like that. It's still available. And so that's why you could advocate for yourself or advocate for your friend. If your friend is really intoxicated and they're not able to really speak up for themselves for what they may need at that moment, those type of nutrients can be given. They can be given in the emergency room, or they can get a prescription for, or that's something that you may want to continue to take and make sure you have those adequate nutrients because you're going to be drinking. Okay, you got to balance that out. So again, vitamin B's. There's different type of vitamin B's, but B complex vitamin B's, you can't go wrong if you do all of them. All right. Folate, of course, and thiamine. You got to make sure if you're going to be doing all this heavy drinking, those are the nutrients that really do protect here. Okay. It's not just about the liver. Those are the nutrients that can protect your mind. All right. Now, moving on from alcohol to marijuana. Ooh, that's a big one. I think the biggest thing I want to say as it relates to marijuana, because we do see a lot of younger patients, college students, post grads that come in because they've had marijuana. And I'm gonna say two things about marijuana. The person who is new to marijuana, and also the person that has been smoking marijuana since they've been young. All right. So I'm gonna start out with the person that is new to marijuana. Okay. That college kid that is trying marijuana for the first time, and all of a sudden you don't feel right. You think you're feeling a high, or you thought you felt a high, but then next thing you know, You get tingling sensation, you feeling hot, you feeling sweaty, palpitations, and then you may also have some nausea, vomit, and maybe some diarrhea. Okay. Um, yeah, you need to come to the emergency room. It's okay. Go ahead and come to the emergency room, especially if you're feeling, palpitations, racing heart, you feel like you're going to pass out. The good thing about the emergency room is it really isn't no judgment zone. You might feel like people judging you because you feel some kind of way about your situation. But us in the emergency room, we see it all the time. So the good thing is about when you're feeling that way, you're having those side effects, or you really don't know what your body is going to do for almost anything you take, right? The benefit of being in the emergency room is that way you can be monitored. You are in a monitored setting. We can also give medication to help your symptoms. Perhaps we can give fluid. Like I said, fluid is kind of, it's a case by case basis. But we can also give fluid to determine, really have you more stable, have you monitored, so that way, you're not going through this alone. You tried marijuana for the first time and you feel like crap. Okay, that's where the emergency room also can come in. So go ahead and come. It's okay. No judgment zone. The other thing that we have been seeing a lot of is vomiting. Marijuana induce vomiting. And so there have been some studies that have, kind of been a little bit more recent, maybe, where they have, or they are considering that maybe patients who started marijuana when they were younger on a regular basis, you got into marijuana when you were in middle school, you just do it all the time, constantly, you're smoking marijuana. Those patients, apparently, some studies are showing that they are at risk more so later on for having marijuana induced vomiting. And those patients, when they come to us, y'all, those patients be in some serious denial. They be in some serious denial. Like, no, I've been smoking marijuana forever. I don't get no vomiting, no diarrhea from marijuana. I'm okay. This ain't from no vomiting. I got gas trouble. This is my stomach. I got gas trouble. I got diabetes. Like, they think they got everything but marijuana induced vomiting. And it's actually interesting is we're seeing a lot more of it. So something to be cautious of if you are one of those now, where you're constantly going to the emergency room, or maybe you're constantly feeling, nauseated after you smoke, or you're starting to feel, upset stomach or vomiting after you smoke. That maybe you are in that category of patients that unfortunately started marijuana early on and it's become so chronic that your gut now is like, can't take it no more. So you are constantly having to have the vomiting. So something to consider, because it doesn't always have to be, your stomach, or an ulcer or appendicitis or, diabetes. There's so many different things that patients who do chronically smoke marijuana, you think is everything but that. And unfortunately, we are seeing, again, marijuana induced vomiting. Opioids. I probably should have done this one first because I'm really passionate about this, but I'll be doing other videos on opioids and substance abuse, overdose. What can we do to avoid overdose? How can you help your friend that struggles with substance abuse, struggles with fentanyl, has tried to, stop and start again and stop and start again. They can't afford rehab. A lot of people can't afford rehab, Where do they go for rehab? You don't have insurance. So heroin overdose. I say heroin overdose, but it's really opioid overdose. But it used to really be heroin overdose, but now it's like fentanyl. I mean, it's like everything, really. But it was so commonly heroin. So I'm sorry, that's just when I say overdose, I think heroin. but really I should be saying fentanyl. It's 2024. Um, Fentanyl, any kind of opioid, those are more popular right now. And unfortunately, the the way that those medications work, they give you that sudden high. You get that feeling of high. You get the, out of body experience for many of them. You get, some patients get really calm. They get the relaxation. They get a certain feeling that goes that overcomes them. But then shortly after that, your breathing rate decreases and your respiratory, your breaths become shallow. So not only are you not breathing as much, you're also not breathing as deep. And those patients, they're really hard to forget. Those patients that come to the emergency room, call 911. Please call 911. That's the first thing you got to do. Call 911. Okay. I know you want to drive your friend and drop them off to the nearest emergency room, because that happens all the time. Oh my God, y'all, you just drop off your friend outside. That happens all the time. The best thing you really can do is call 911. Well, actually, let me take that back, because it really depends on where you are. If you're in a rural area, 911 you got to wait at. Okay, so let me, because nowadays paramedics are loaded. Let me, EMS rescue, God bless them. The response time may actually be a little bit longer. So things have changed. So let me kind of rephrase that, because the paramedics and rescue, woo, child. Oh my God. God bless paramedics and first responders. There may be a delay. So yeah, you do need to evaluate that situation, how far or close you are to your nearest emergency room. Okay. Because it actually may be quicker for you to do the drop off than to call 911. So you got to do that judgment call. All right. Clarify that. But I just say 911 because people think, oh, they're so embarrassed. They don't want the police to come, or they don't want the ambulance to come to their house or whatever. So they're scared to call 911. That's why I said, don't be afraid to call 911. But anyway, those are the patients that are, if you wait too long, time is money. They always say time is money, but time is brain and time is heart. The longer you wait before you get that friend or person to the, emergency room, or before you call 911, the harder the resuscitation is going to be. Those patients that have the families of those patients who have succumbed to unfortunate substance abuse, accidental overdoses, those are really hard ones. The accidental overdoses, when you have to talk to the family and tell them that their loved one passed, those are really, really tough ones. And part of the reason why I feel as though now it's also even probably more tough moving forward is because now, y'all, listen, I ain't no I don't even want to be no spokesperson for this. I'm not doing this to be no spokesperson for nothing. But there is a medication that is available by prescription, and it is called Narcan. Y'all, if you know, even if you are, I did a video, and I'm not trying to promote it I'm not trying to promote drug use by any means, but this is like a condom for intercourse. You're trying to protect yourself. Okay, this may be like plan B for after. You're just protecting yourself. I'm not promoting it, but I'm saying, look, if you're gonna do it, this is what you need to kind of consider I even said drug dealers might want to, have some Narcan because it's like, man, you don't want your client, your customer, you don't want to be losing your customer either. Like just something where you guys know that if you are going to do this, there is a reversal agent available that can help you. It's almost like if you know you're going to be doing this, you should just go ahead and have you some Narcan right over there on the counter too. So if somebody sees you, I'm just, just look, we got to think outside the box now because this is available. And rather than the deaths of opioid and substance abuse going up, we need to be going down. We need to be going down. So the only way we're going to go down or decrease the deaths associated with opioids is by videos like this. And also making sure you know that there's something available where you might not, you ain't gonna like the after effect. Yeah, we know. We know. What ends up happening is when you squirt the medication in the nostril. So that's what you're going to do. You're going to buy it from your favorite drugstore, CVS, Walgreens, Walmart, Public. Well, I don't know, the larger, every pharmacy has it. And you do not need a prescription. You do not need a prescription. You can go up to the pharmacy. What I found is that they keep it behind the counter. So some places may keep it with the drug testing because they got urine drug testing kits. It may be on that aisle, but if it's not on that aisle, then it was up front. So I'm actually a collaborating physician with CVS, Target, MediClinics. I know you just ask up front. You ain't even got to go to the pharmacy. It's up there with the Nicorettes and the nicotine, all the gums and all of that. You just ask them, and they give it to you. It's about I think it was like $45. It's like $45. So it's available. No prescription necessary. Have one nearby. If you are a family member or a friend of someone that is struggling with this, and you've tried all that you could try to get them to do whatever they need to do to try to stop it and it ain't working, get this. Get this. Because in 2025, y'all, we got to reverse this. The opioid epidemic when there's something available. All right, it's called Narcan, Narcan. I ain't getting, this ain't no ad, this ain't no sponsorship, this is nothing for that. This is for educational purposes only, really to let you know that it exists. It exists. Break the high or you die. Break the high or you die. Like it's just that's it. And it's used to be a time when something like Narcan wasn't readily available. Even like the EMS, even for physicians, we had to get IV access, and then it got better. We could just do a shot, and then it got better, and we could just squirt it in the nose or in the mouth. And so there have been so many advances from a medical standpoint, but getting that into the community, it ain't there. It's not there. So that's what I wanted to say. That alcohol, marijuana, and then opioids. Those are the three things that I kind of want to talk about in this video with those key points for each one. All right. I am Dr. Jerry ER. I'm your good ER doctor trying to help y'all be good patients. Set these expectations, right? Like, trying to avoid the cold blue. We got to move, But what can you expect when you go to the emergency room? Because when you call your doctor, what your doctor going to do? Your doctor is going to tell you to go where? To the ER. to the ER. All right, they gonna tell you to go on down there and have you waiting for, well, not 4 hours, because they're gonna have you waiting in the emergency room because they don't have an appointment. So that's where I come in, trying to help y'all be good patients. Check me on live Thursdays on Instagram. Trauma Thursdays, we'll be doing that. Got some videos on YouTube, so we'll be kind of doing things, a little bit more things here on YouTube, Code Blue. Um, I think that's it. Dr. Teresa Yar, Cash App. Oh, Cash App. If you want the Cash App this week, you have to subscribe. You have to be a subscriber here, and you also have to be a you have to go to the website and subscribe to the website. So, website drteresa.com. Okay? drteresa.com. Scroll on down, and then you will see where you can just put in your email. Ain't nobody, look, I ain't trying to send y'all a bunch of emails. I ain't got time to be sending emails. I don't like getting emails myself. So please understand. You will not be getting a bunch of emails from me. No. It's more so if anything happens, keep you up to date, maybe once a month, once every other month, something like that. But you ain't gotta worry, you ain't nobody, I ain't gonna be spamming you. You ain't got time for that. All right. Bye, y'all. See y'all next Code Blue.